I'm Isabel. I'm here at Haley, and today I'm here for my cool sculpting for the tummy area. It's been a concern of mine for a very long time, even though I exercise quite regularly in that sense, but it's really hard to remove all the tummy fats. So I hope I'm here to see results.
Hi Isabel.
Hi.
Hi, welcome to Haley Medical Aesthetics and Haley Body Slimming Clinic. I'm Dr. Terence Tan.
Hello.
Yeah, I heard that you have some bodily concerns.
Yes, my main concern is actually like my tummy area.
Okay.
It's very hard to lose the fats around the area, even though I try like cardio and I run quite often, which I don't know whether that will help much actually. Yeah, but it's been like that for like many years already.
Okay.
So,
Have you tried other forms of treatment, before coming here?
no, for body.
Medications, yeah. Okay, understand. So I think in general, when people come to see me, there are two major concerns. Number one would be weight, okay? So we determine that you're not overweight, your BMI, well, is normal. Won't talk too much about that.
Okay.
So what you're concerned about is body contour. Adults have a fixed number of fat cells within their body. This is genetically predetermined, okay? So for example, between men and women, we're different. You probably have a bigger hip. I probably have a smaller hip. I probably have a bigger tummy. You probably have a slightly smaller tummy.
Okay.
So there are genetic differences between male and female. Between different people, there are also differences. So when people have a little bit more fat over a certain area, otherwise known as stubborn fat, no matter how much you train, it will still be a problem. Okay? So there's a big distinction between the two. So for example, maybe I use this little illustration to show you. When we gain weight and when we lose weight, our fat cells become bigger and smaller, but the total number of fat cells over the area is unchanged. So we don't make new fat cells as adults, neither do we normally destroy them. And therefore, if we are genetically more prone to have fat cells over a certain area, then no matter whether we are heavier or slightly lighter, it will still be a problem. So for the remedy for that would be really to do body contouring through a machine or any treatment to reduce the number of fat cells over the area of concern. So it can be done surgically, but of course, in terms of ease, in terms of less downtime, non-invasive body contouring is probably a better option for most people. So what we do very often in our clinic is cool sculpting. Okay, so these two machines you see behind us. So the long and short of it is fat freezing. Okay, these machines will have an applicator. The applicator will suck in the fat and the overlying skin into the applicator, freeze it between about 35 minutes to an hour, depending on which applicator we use, which also depends on which area we are treating. Okay, and the scientists have shown that within this period of time, approximately about 20 to 27% of the fat cells over the area will become frozen, and slowly they will die through a process called apoptosis. Don't worry about what apoptosis is, but thereafter the body thinks that these cells are foreign to them, and the immune system will slowly take away these cells over a period of between about 2 to 3 months. Yeah.
So how does it like expel this?
Yeah. So
toilet, is it?
yeah, you're right.
Okay.
but not quite. Okay. So our immune system would be like a policeman of our body. They'll go around and look for things that they don't like, which are foreign to the body or harmful to the body. So they clear bacteria, they clear viruses, and they also clear dead cells. Okay.
How long usually is the whole like process for making the tummy slim?
Okay, so because it's unlike liposuction whereby the fat cells are physically removed, it requires some time for our body to get rid of these cells. So in general, we tell people to expect a good result in about 2 to 3 months after the treatment.
Okay. So do I need to like do extra exercise or just normal?
No. Science has shown that the machine does most of the work, and nothing that you can do will make the results better. There's only one thing that makes a slight difference in that massage immediately after the applicator taken away has been shown by research to improve the effectiveness of the procedure, and therefore we should always do that after taking out the applicator. That's the only thing which makes a difference.
Okay, so that means even though if I eat anything I want, will I be like gain back all the weight?
Okay, so weight and body control is not quite the same. Okay, so you still have to make sure that you control your weight through healthy lifestyle, exercise, controlling your diet. It's not a substitute. So body contouring reduces the number of fat cells over the area concerned, but you still have to have a healthy lifestyle.
Okay, understand.
So for today, we will probably be doing an assessment, right? Because as with all good treatments, all good machines, no matter how good the machine is, if you don't do the treatment properly, don't plan properly, you might not have a good result.
Okay.
And we're also quite lucky in that over the last few months, a new machine, an upgraded version of CoolSculpting has just come to our shores.
Okay.
And it's called the CoolSculpting Elite. It's a complete revamp, a complete redo of the system. New technology has come about, and this is a better machine. Yeah, it's faster, it is safer, it is more even, and it's more efficacious. So we'll use that for you. Okay, so I'd like to present to you our very own Haley slimming booklet. Okay, so it's a booklet that myself and my staff have come up with, and it contains quite a few things. Okay, firstly, it is a record of your weight, and it's a record of how you are at this point in time. So it's good for people who have weight concerns and they want like a scorecard, a record, something to motivate themselves. Some motivational statements, they're all inside here.
Okay.
And for people who are really actively trying to lose weight, sometimes they do need some help in terms of medication. So it also describes what the medications which are available worldwide and in our clinic. We also give them some slimming strategies, okay, in terms of diet and in terms of exercise. This is not a holistic slimming guide, but I think that through the years, a lot of people ask us very, very similar questions, and we always say the same thing to them. And I think this is just like a primer, a little bit of a tips kind of section to get them started in the right direction. Yeah.
Okay.
So there's slimming, dieting, exercise, and even a way to simply count calories. Have you ever tried counting calories before?
No.
Yeah,
I'm bad at math, so
don't even start, because counting calories is really, really difficult, right? Okay. So we teach people how to estimate calories, and also introduce some of the procedures that we have done, the pros and cons, how we do it. Yeah. So this is something that we worked really hard to come up with. So I'll pass this to you.
Oh, thank you.
Yeah. So please take a read when you have time.
Okay.
So now we are here for assessment of the tummy area which you are concerned about. For us to, as we say, for us to have a good treatment, we need to have a good assessment. Okay, alright, so we've come to treatment time. Okay, so you see this screen, it tells us exactly what to do, so there's no mistakes. In fact, there is, apart from the fact that we need to plan properly, the machine actually takes care of everything else. So first we say where we want to treat, yeah, and it tells you what temperature for how long. So this is the bigger applicator. These small little dots here, these are actually sensors. So there are 6 sensors within this applicator, which tells us precisely what temperature it is, so that it doesn't get too warm and too cold.
So I just finished with my cool sculpting treatment. It feels quite good actually. The initial part when the machine was placed onto my tummy, I felt quite cold, but later on I got used to it. Yeah, so I'm waiting for the results and very excited for it in about 2 to 3 months time.